Gout is our final condition to review. It is a systemic inflammatory disease characterized by urate crystals that deposit in the joints and other tissues. There is a primary process of gout and a secondary process. The primary process involves uric acid that exceeds the amount the kidneys can excrete, so it is stored in the synovium and other tissues. This happens because of family history and an X-linked trait. Usually men 40 to 50 will experience this type of gout. Secondary gout results from hyperuricemia caused by another disease process, including renal insufficiency or diuretic therapy and crash diets. The signs and symptoms of the primary process occur in 3 clinical stages. Asymptomatic hyperuricemic is just that. There are no symptoms and no treatments for that stage. The acute stage is extremely painful and occurs in 1 or more small joints. The great toe involvement is typical. The ESR, or erythrocyte sedimentation rate, is high as found in osteoarthritis. The 3rd stage, the chronic tophaceous gout stage, you can develop kidney stones. And the tophi that occurs in that stage are commonly found in the fingers at the tips of the elbows, around the big toe, but the tophi nodules can appear anywhere in the body. So the stage that patients would seek most care for is the most painful one, which is the acute stage. Patient education is important for gout. There are drug and non-drug therapies that we include in patient education. The drug therapy for gout is allopurinol or Xyloprim. We teach the patient to take this medication after a meal with a large glass of water, to make sure that they monitor their uric acid levels, and not to take aspirins or diuretics because these medications can precipitate an attack. In terms of diuretics, patients receiving more powerful loop diuretics have a higher risk of developing gout than those receiving the weaker thiazides. Now, with gout, what's interesting is that stressful events can also precipitate an attack of gout. That includes physiological events like myocardial infarctions and having a really bad argument with someone or high emotions can cause a gout attack. Let's look at a non-drug scenario for a patient with gout. Mr. Goldstein is turning 87 today. He is hospitalized with an acute gout attack. His 4 grandchildren came to visit him. They brought balloons and 4 of his favorite meals or desserts to eat. Unfortunately, Mr. Goldstein has a low purine diet because of the gout attack, and one of the meals that his grandchildren brought is restricted. Out of these images, which meal would be off limits? You have a vegetable pasta, a slice of chocolate cake, rare steak and alcohol, and a strawberry mango smoothie. Mr. Goldstein has good taste. The one that he cannot eat on a low purine diet is the rare steak and alcohol. Those 2 items can precipitate a gout attack. It will increase the amount of uric acid that his body has to excrete. So he can enjoy the other 3 and his balloons and his visit from his grandchildren, but he cannot have the steak and wine. We have reviewed 4 conditions that can be very painful. If you had to live with one of these conditions, which of these conditions would you rather have? And what kind of skills would you want your nurse to have that is taking care of you? We ask these questions to encourage you to practice empathy when you're taking care of patients with these conditions or any other conditions. Imagine that as you with a fixator on and you are scared or saddened by the fixator. You would want someone to encourage you that the fixator is not going to be on forever and that you understand that it's not a fun thing to look at and that it can be very scary. If you are unable to express that you're in pain and you have a family member telling your nurse that you're in pain, you would want the nurse to listen and see what pain management options are available to you. You also want a nurse that's going to be concerned about getting you moving to prevent neurovascular complications and who is skilled in using neurovascular complications and takes the 5Ps seriously. So we ask these questions to encourage you to have empathy for these patients with these 4 conditions. That is the end of our lesson. I thank you sincerely for listening. If there are any questions, you can ask them at this point about any of the conditions or any scenarios that I've seen in the hospital regarding these conditions. Thank you.